this video, depression and mania will be explained. Specifically, it will cover the mood episodes referred to as major depressive episode, manic episode, and hypomanic episode. These clinical mood states are often referred to as extremes or poles on a continuum of mood. On one end of the continuum, we have extreme low mood, called depression, and on the other end, we have extreme high mood, referred to as mania. While it may be helpful to understand these states by thinking of them as extremes on a single continuum, depression and mania are not perfect opposites, making this label somewhat misleading. This will be discussed further later in the video. Let's begin with depression. In its severe and clinical form, depression is referred to as major depression, or a major depressive episode. Major depression is a very severe, disabling form of depression that often wreaks havoc on one's ability to function and their quality of life. In addition to a low, depressed mood, a major depressive episode is marked by a number of other symptoms. These symptoms may include a lack of energy or fatigue, where even the simplest of tasks may seem too daunting to perform, a lack of pleasure, called anhedonia, where the individual feels as if nothing gives them pleasure, that they don't enjoy anything anymore, a lack of drive or motivation, called avolition, and a lack of interest, called apathy, marked by not caring anymore, not being interested or invested in things that the person was previously interested and emotionally invested in. Often individuals will experience changes in their sleep and in their eating habits, leading to weight gain or loss. Even further, major depression can disturb a person's ability to move and their cognitive abilities, like concentration and memory. Individuals in this severe state are often plagued by excessive feelings of worthlessness and hopelessness. For many, this psychological and emotional pain becomes so unbearable that they may contemplate or even attempt suicide. For a DSM-5 diagnosis, the symptoms must persist for a minimum of 2 weeks, although without treatment they will often last for several months, and sometimes even longer. On the other end of the spectrum is mania, or what is diagnosed as a manic episode. Although this comparison is imperfect, mania in many ways is the opposite of depression. While major depression is typically marked by many deficits, including deficits in energy, pleasure, and drive, mania is marked by an excess in many of these areas. In addition to elevated or expansive mood, a manic episode may include a significant increase in goal-directed behavior and energy. Often these individuals will have so much energy that they are sleeping very little, perhaps feeling rested after only 1 or 2 hours of sleep. Individuals in this state are frequently much more talkative, and their speech may be more rapid than usual, sometimes to the point where they are incomprehensible. Related to this, they may also report that their mind is moving faster than normal, or that their thoughts are racing. They may be easily distracted by what is going on around them, and their thoughts and ideas may be excessively ambitious or grandiose. They may even begin believing that they are capable of things that are not humanly possible. Due to these types of thoughts and the increased goal-directed behavior, these individuals will often seek out activities that are dangerous, painful, or irresponsible. Common examples are unrestrained shopping sprees when they can't afford it, or impulsive sexual behaviors that are not typical of the individual. That being said, and as was mentioned earlier, mania is not a perfect mirror opposite of depression. When in this state, individuals will often feel irritable and easily agitated. Reports of dysphoria and depression are also fairly common. So while it is helpful to think of these mood states as extremes on a continuum, it is equally important to understand that this label is imperfect. With all of this combined, individuals in this severe mood state are often mislabeled. Let's step into the question corner to tackle this. To the average bystander, a person in the full manic state is often confused with what? a person who just ran 5 miles, a person on a psychostimulant like methamphetamine or cocaine, or a person who is grieving the loss of a loved one. If you selected B, a person on a psychostimulant, then you got this one right. Due to the surge in many areas of functioning, an individual in the manic state might appear as if they have used a powerful psychostimulant. Finally, with a manic episode, these symptoms are so severe that they will affect one's ability to work or socialize, lead to hospitalization, or even cause psychosis, where the individual experiences delusions and/or hallucinations. To be diagnosed, the symptoms must persist for at least a week, although they typically last much longer without treatment. There is also a diagnostic label for a less severe state of mania, referred to as hypomania, or a hypomanic episode. The symptoms for a hypomanic episode are identical to those of a full manic episode, but they are not so severe that they cause impairment, hospitalization, or psychosis. If any of these occur, it would then warrant a diagnosis of a full manic episode. Even further, the symptoms only need to persist for a minimum of 4 days for diagnosis, as compared to the 1 week minimum for a full manic episode.